P.A.R.T.Y Program, which stands for Preventing Alcohol and Risk-Taking Behaviour in Youth, is an injury prevention program. It's aimed at school kids from Year 10 to Year 12, where we're actually bringing them from the school environment into a clinical environment and showing them firsthand what the consequences are of risk-taking behaviour. It's something they can't learn in a classroom. They come into the hospital environment, they use all of their senses. They can see, they can smell, they can hear, they interact with patients and other healthcare staff as well.
I really support this program because it's really good for our youth to see really what can happen out on the streets and even at home or what have you. And it's being responsible, thinking before acting, and you can always move forward, but you can never go back, and that's a key thing about this program today.
The aim of the program and what my main objective is to teach the kids about the consequences of risk-taking behaviours. I don't want any of them here as one of my patients. I want them to be able to take their take-home message, live once, think twice.
It gives us a very haunting reminder that danger is everywhere and surrounds us every single day.
What I'm finding is that I'm seeing more and more patients your age. And it's actually quite disheartening to see young kids like yourselves involved in unnecessary incidents.
To deliver the death message, to see the victims on the scene, to deal with the families who turn up and the trauma that comes after it. I've held people's heads together at road scene traumas.
I'm 20 years old, and when I had my accident I was not long 18. So my friend jumped in the front seat and I jumped in the back seat, and in my drunken state didn't put my seatbelt on.
It's also actually hard to think that if I was in that position, it would be very, very hard for me and my family to see me suffer that way.
All this stuff sticks with you. All this stuff stays in here. You can't get rid of it.
The first thing I remember when I woke up was just looking around, not knowing what was going on really. Went to get up, nothing moved, I couldn't move. Nothing was coming out of my mouth, I couldn't talk. And then I just laid there not knowing what was going on. Then my parents walked in and said, "You're in a car accident, you'll be in a wheelchair for the rest of your life." So that was really hard, as you can imagine.
The best part of today was trying out the techniques and the ways in which they allowed people to rehabilitate themselves. It taught me that even though we have sophisticated medical techniques, there is still nothing as better as having preventive measures against it. Recommend it to other students. I think it is a great opportunity and a great learning opportunity, because sometimes to learn from other people's mistakes will make us better people in the end.